My name is Dr. Matthew Payne. I'm a family medicine physician at East Falls Primary Care and Specialty Clinic. One of the most common conditions that we see in our primary care office is that of being overweight or obese. And many patients seek out our advice and help with weight loss. So today I'd like to talk about obesity with its associated health hazards, as well as an overview of the management of obesity. I'd like to begin by briefly defining obesity. Body mass index is the easiest and most practical way to define obesity. The World Health Organization and National Institutes of Health recognize overweight as a body mass index greater than 25, equal to 29.9, and obesity as greater than 30. Also, waist circumference is an important measurement when defining obesity. It has been shown that central obesity particularly increases risk of cardiometabolic risk. So in men, a waist circumference greater than 40 and in women greater than 35 is an important measurement to know. Obesity is a chronic disease which has increased in prevalence and has now become a global epidemic. There are many factors that contribute to obesity, including genetic factors, environmental factors, medications, as well as the increased availability of energy-dense foods. However, most cases of obesity are related to increased caloric intake as well as sedentary lifestyle. We've known for a long time that there are several health hazards associated with obesity. The most prevalent among these is type 2 diabetes, with about 80% of type 2 diabetes being directly associated with obesity. There are other health risks associated with obesity, including hypertension, elevated cholesterol, sleep apnea, increased risk of cardiovascular disease, and stroke. More than 2/3 of adults are currently trying to lose weight or maintain their weight. I'd like to discuss some of the medical strategies that we use to help those patients accomplish that goal. The initial treatment of obesity includes diet modifications, behavioral therapies, and exercise, and in certain circumstances, drug intervention or surgery. The goal of behavioral therapy is to produce long-term changes in eating behaviors and to modify diet and improve exercise. There are many ways that we can accomplish this. Self-reporting by using a food diary, joining support groups, as well as seeing a dietitian or nutritional counselor can all help in this regard. Other behavior changes can include changing of eating habits, including chewing your meals slowly, drinking sips of water between bites or during the meal, or even leaving the table during a meal. One of the challenges to behavioral therapy is setting realistic expectations that can be met by the patient. Most often, patients would like to have an approximate 30% weight loss from their current weight. This is oftentimes unrealistic. Most studies show that about 5 to 7% weight loss is an appropriate amount. Dietary changes are also another key element of weight loss. It's important to realize that calories from any source in excess can cause weight gain. A lot of foods available in our stores today, if it comes in a box or a can, are high in calories but low in nutrition. Some helpful tips when choosing a diet would include not shopping on an empty stomach, and also sticking to the outside of the store where you can find the most fresh fruits and vegetables and lean cuts of meat. Also, it's important to realize there are many types of diets. None of them have been shown to be more effective than another. The most important factor is being able to adhere and maintain the diet. Most diets recommend low caloric intake of about 800 to 1200 calories per day. Exercise is also very important in treating obesity and has been shown to be more effective in preventing obesity. Exercise has very minimal impact on overall weight loss, but has been shown to be excellent at maintaining weight loss once achieved. The current recommendation is to exercise 30 minutes per day, at least 5 to 7 days per week. An important fact to remember is that exercise can be additive, meaning if you exercise only 10 minutes 3 times a day, it's the same as doing it all at once. There are also many drug therapies and herbal remedies that have been used to promote weight loss, and oftentimes patients ask about these medications when they come to our office visit. It's important to realize that many of these medications have side effects that need to be tailored to the individual. There are certain indications to using these medications, including a body mass index greater than 30, despite efforts in weight loss related to diet and exercise. A key concept to remember is that drug therapy is not a cure for obesity, and that most of these medications will have a therapeutic maximal effect, at which point weight loss no longer occurs. And also in most patients, once the medications are stopped, weight increases. There are several prescription strength medications that can be used for weight loss, and I would encourage you to talk to your physician about each of those individually. Also, there are many over-the-counter herbal remedies that people use to promote weight loss. These can include green tea, Hoodia, and Garcinia cambogia. And lastly, there are those patients who, despite drug therapy, exercise, and behavior modifications, still have increased risk of comorbid conditions including heart disease, diabetes, who may benefit from bariatric surgery. Lastly, bariatric surgery has been used as an option in those patients who have not been able to maintain weight loss through diet, exercise, and drug intervention. Obesity is a common and complex medical condition, but there are definitely ways to treat this. I would encourage you to seek advice from your medical provider or physicians, or schedule an appointment for more information.